Which of the following terms describes the maximum volume of air a person can exhale after maximum inhalation? A. Functional residual capacity. B. Residual volume. C. Vital capacity. D. None of these. The answer is C. Vital capacity. Vital capacity is the maximum volume of air a person can exhale after maximum inhalation. Residual volume is the air that remains in the lung after forced exhalation, while functional residual capacity is the volume of air that remains in the lung after a relaxed exhalation. In the average adult, how much air remains in the dead space of the lung after normal expiration? A. 250 milliliters. B. 750 milliliters. C. 150 milliliters. D. 70 milliliters. The answer is C. 150 milliliters. Dead space is the volume of air that remains in the trachea, bronchi, and bronchioles during respiration. It does not enter the alveoli and so does not participate in gas exchange. In the average adult, the amount of air left in the dead space after expiration is 150 milliliters. What is the average volume of air breathed into and out of the respiratory system during tidal breathing? A. 1,200 milliliters. B. 1,000 milliliters. C. 500 milliliters. D. 750 milliliters. The answer is C. 500 milliliters. Tidal breathing is the term for relaxed inhalation and exhalation, as opposed to maximum inspiration and forced exhalation. The average volume of air breathed into and out of the respiratory system during tidal breathing is 500 milliliters. Which of the following would cause bronchoconstriction? A. Cold air. B. Allergens. C. Parasympathetic input. D. All of these cause bronchoconstriction. The answer is D. All of these cause bronchoconstriction. There are many factors that can cause bronchoconstriction. Some of them are normal physiological responses, such as parasympathetic input or decreased partial pressure of carbon dioxide in the alveoli. Other causes are pathological, such as allergic bronchoconstriction or asthma triggered by cold air. What are the two types of alveolar cells? A. Interstitial cells and active cells. B. A cells and B cells. C. Type 1 and Type 2. D. Primary and secondary cells. The answer is C. Type 1 and Type 2. There are two types of alveolar cells, Type 1 cells and Type 2 cells. Each cell type has a unique function within the alveolus, and the dysfunction of either cell type results in serious respiratory pathology. Type 1 cells are simple squamous epithelial cells that account for about 95% of all alveolar cells. They are the primary cells responsible for diffusion of gases across the respiratory membranes. Type 1 alveolar cells are responsible for secreting surfactant, which facilitates the diffusion of substances across the epithelium.